I'm Dr. Thomas Dancoes, an emergency medicine trained, board certified emergency medicine physician. Emergency medicine physicians work primarily in hospital emergency departments and care for patients who are acutely ill or who have suffered traumatic injuries. Within many emergency departments, non-physician practitioners are also an important part of the care team. The roles of the non-physician practitioners and the emergency medicine physicians are somewhat different. The differences are primarily due to our training and experience. The emergency medicine physician on average completes 11 to 12 years of education and training after school. And this includes 10 to 16,000 patient care hours, as compared to a nurse practitioner or physician assistant who completes on average 6 years of education after high school, including approximately 1,000 to 2,000 patient care hours. The American College of Emergency Physicians policy statement states that the gold standard for care in the ED is that performed or supervised by a board certified or board eligible emergency physician. Also, a patient survey performed by the American Medical Association showed that 4 out of 5 patients prefer a physician to have primary responsibility for leading and coordinating their healthcare. In today's healthcare environment, it is confusing at times for patients to who exactly it is that is providing their healthcare and what level of training and experience that healthcare provider has. Unfortunately, scope of practice expansion and legislative changes have now allowed for the possibility that a non-physician practitioner with very little training and experience could be practicing independently. This could prove to be a very dangerous situation for patients. In emergency medicine, it is vitally important that an emergency medicine physician be the leader of your care team. They not only have the knowledge and skills to provide life-saving treatment and procedures for you or your loved ones, but they also provide guidance, collaboration to the physician assistants and nurse practitioners. When severely ill patients arrive to the emergency department, the physician can either collaborate with and provide guidance to the non-physician practitioner, or in many cases, take over the care of these patients at a moment's notice. Common argument and misconception for expanding scope of practice for non-physician practitioners is that it will improve access to care. A review of the Graduate Nurse Education Demonstration Project showed that it is difficult to get non-physician practitioners to relocate to rural areas, showing that only 9% of graduating nurse practitioners went to rural areas. Many less populous areas continue to lack healthcare professionals of all types. However, regardless of where you choose to live, your healthcare team should be led by a physician. The advice that I have for my patients and families when receiving emergency care is to first realize that both physicians and non-physician practitioners play important roles on the team. However, one does not replace the other. And I would make sure that you ask questions as to who it is that is providing your care and what level of training and experience that person has. It is important in the specialty of emergency medicine that you receive the highest level of care and that a physician is leading your healthcare team.